Hello and a warm welcome to Dr. Beliku YouTube channel. Today I've picked up a very interesting topic for you, a question that crops up in most of the clients visiting a homeopathy clinic. Why do homeopaths ask so many questions? Don't you have any other better job to do? When I say that I have headache, why can't you just give me a pill and help me get rid of my headache? Why do you want to know how I sleep, where do I sleep, how is my thirst, what has affected me, etc., etc. What do you do when you are suffering from a condition like headache? Most of the people would pop in a pill, a painkiller, and try to manage themselves for a couple of days. If it doesn't subside, then they'll think of going to a doctor who may prescribe similar or a higher dose of medicine. But when you come to a homeopathy doctor, we perform physical examination, trying to check your BP, pulse, heart rate, or any other system of the body that needs an examination based on the the symptoms that you have narrated. We do try to analyze all those symptoms, and we ask a lot of questions, which seems a lot, but what we are trying to achieve is trying to individualize this person who actually is an individual, because homeopathy strongly believes that no two people suffer from the same medical condition or a similar medical condition in a similar way. Though at the outset the symptoms do appear similar, how the individual perceives and how it is affecting this particular individual is very much important for any homeopath. So we ask you a lot of questions to get to the root cause of this physical condition. As the example that we took earlier was headache, let me elaborate on this. Say like there are 3 people suffering from headache. Should all the 3 get the same medicine? Because it's just headache, head is same for everyone, right? So they should all get the same medicine. It could be true in other systems of medicine, but when a homeopath takes up a case, they have a different way of looking at each individual. Though for technical reason, head is classified into various regions, head is one unit, but we as doctors, for our better understanding, we classify it into various regions, say like the front or the frontal region, the back or the occipital region, the sides, or as we call it as temporal region. So we ask you, where is the headache, which part of the head hurts, and and one more region, this is the vertex. So which part of the head hurts would be one of the questions that a homeopath will ask you to know the region specificity of this symptom. And then they'll ask you, when does the headache increase or decrease, which part of the day that a headache increases or decreases, or by doing whatever activities that you perform on a daily basis, how do they affect your headache? Would they bring on the headache? Would they relieve your headache? All these questions actually points the homeopaths at various medicines, and by questioning more and more, he or she is actually getting to the best medicine possible that will help you overcome your physical condition in a very swift, in a very fast manner. Okay, so say for example, one person is suffering from headache. They must be dehydrated. They're not drinking much of water. So we ask, what is that is preventing them from drinking more water? The answer could be that they have incontinence of urine, which is not being able to control the passage of urine. There could be some issue with the bladder or the muscles in the pelvic floor, which is preventing them from controlling the urine in the bladder. So that to avoid that embarrassing situation for them, they would try to drink less of water, which leads to dehydration and thereby causing headache. So we give a medicine like causticum or apis to help them overcome the incontinence of urine. Thereby they gain more confidence and they can drink water, and thereby the dehydration part is addressed and the headache is gone. If I just merely give you a medicine that is trying to treat this symptom called headache, the rest of the complaints which are the cause of the headache can never be addressed. So a homeopath always tries to do this process. I call it personally reverse engineering. Join the dots in the backward direction to see where, as far as possible, to see where the symptom that the patient came to the doctor with is starting from. Okay. Another person could be also suffering from headache, and here the reason could be that he or she exercised a lot of physical activity. They could be jumping, hopping, skipping, or performing calisthenic exercises, etc., and they have developed headache due to a lot of muscle or nerve strain. If I just give a medicine that does not have anything to do with helping the muscles to relax or treating the aggravated nerve, the headache would not go away. Merely giving them a medicine that would cover headache would not be able to take care of the rest of the aspect where the muscle is strained or the nerves are impinged, etc. Another scenario, a person could be experiencing headache wherein they might have lost a near or dear one and they're grieving, and through this they have developed a headache. That's an emotional trauma and emotional stress. So here also a homeopath cannot just simply give a medicine that says okay for headache. No, we'll have to again ask you questions as to how this sad news has affected them, what are they feeling, and what are the emotions that are going on in their mind. And then there is a medicine specifically called sepia. Why do we give this medicine called sepia? Because it is very specific complaint called ailments starting from the loss of the near and dear one. So when such a medicine is given, the headache will also go away very fast, and at the same time we have helped them to overcome this emotional trauma. So when you help them overcome the root cause, which is emotional trauma, that is the loss of near and dear ones, the headache will also be gone. So looking at the last symptom visible and trying to think that is the whole and soul of the disease is a big mistake. You'll have to always trace back to from where this symptom is coming from, and then when you treat, the treatment is successful and the patient actually goes back with a better relief. So we ask you a lot of questions as to when it started, how it started, how is it affecting, what you feel during this, how do you experience this pain. Yes, we are probably the only system of medicine where a homeopath asks you, how do you feel this pain? How do you experience this pain? For example, when your finger is burnt with a matchstick, there is pain that you experience. When a pin pricks your finger, you do experience pain. But are they same? They are two different type of pains. One is burn, another is prick. So we try to get to those specifics which most of the other systems miss. So that's why when you go to a homeopath asks you a lot of questions only to get to know to the root cause and how individual are you, even though you're experiencing a relatively common symptom. So another question may pop up in your mind after this is like, do all homeopaths ask so many questions in every case? Is there no exception? Yes, there is exception. When there is grave life-threatening danger, when the person is, when you have met with an accident or there is a case of poison or anything that is threatening the life at this very moment, we do not sit and try to ask you all those questions. How is it affecting you? You may not be in the state to even answer that. So that is commonsensical. We do not then spend time in trying to get subjective symptoms. Then we'll go with more objective symptoms where we observe, we do examinations, we may even inquire people surrounding that person and then get certain details which will help us prescribe medicines to save that life. So in that case, we may not go with detailed objectives, subjective symptom, but we will go with a lot of objective symptoms. So through this video, I'm trying to help you understand that whenever you go to a homeopath, please be prepared that they'll ask you a lot of questions, and these questions are not meaningless questions. They are actually trying to get to know the root cause and trying to identify who you are, how you're suffering from, and what all affects you, so that a better medicine can be prescribed with an ultimate aim that you go back home with your medical condition being cured, treated, or palliated in a very fast way. Okay, thank you. That's all for now.